Welcome back to the Healthy Chicago podcast, where local health professionals and their guests discuss the latest public health issues affecting Chicagoans. Welcome back, Chicago, to our Healthy Chicago podcast, where we have city medical professionals and their guests talk about public health issues affecting the people of Chicago. I'm thrilled today to have Joy Macatangay here with me. Joy, can you introduce yourself and tell me a little bit about what you do for the health department?
Of course. My name is Joy Macatangay. I use she, her pronouns, and I'm a public health administrator in the Office of the Chief Medical Officer at the Chicago Department of Public Health. And I focus on healthcare access. So what we'll mostly be talking about today is Medicaid redeterminations or Medicaid unwinding, which is mostly what I have been working on over the past few months.
Got it. Medicaid redetermination. Can you just tell us a little bit about what that means?
Yeah, so during the COVID-19 public health emergency, there was a continuous coverage provision for Medicaid. In other words, people who were enrolled in Medicaid didn't have to renew or redetermine. Generally, with Medicaid, every year you have to submit a redetermination to show that you still qualify for Medicaid. And during the public health emergency, people did not have to do that. So we're kind of reintroducing that back. And so many people, especially people who have maybe enrolled in Medicaid during the public health emergency, never had to submit for redetermination. So because of that, people are being disenrolled from their Medicaid.
So this could be brand new. This whole process could be brand new for people who just only enrolled in Medicaid during the public health emergency. And for other people who had Medicaid before, this is sort of a return to normal, but they may have sort of forgotten a little bit about this process in the meantime. Is that right?
Yes, definitely. There's also the way that it has been rolled out is that people receive notification about redeterminations through the mail. So if people have moved over the past 3 years, if their contact information has changed, they might not be receiving the notifications in the mail that they need to submit for redeterminations.
I see. So this may come as a big surprise to people who didn't realize this was happening and all of a sudden might realize that they no longer have Medicaid?
Yes, correct.
Okay. All right. So that sounds a little bit urgent.
Definitely.
Okay. So what should people do?
To get connected with care, first and foremost, if people are enrolled in Medicaid, we encourage them to go to Abe.illinois.gov, Abe.illinois.gov.
Okay.
And click on Manage My Case. And from there, people should be able to see the status of their Medicaid, when their redetermination due date is, and all of that information. And if people get that information late, if they get their redetermination paperwork late and maybe miss their deadline, I encourage them to still submit for their redetermination paperwork. There have been some flexibility with deadlines just because of technical issues and stuff like that. So when in doubt, resubmit. And also, if you miss your date by a substantial amount and for some reason they don't accept your redetermination paperwork, you can still submit for Medicaid in general, like reapply, and you can get up to 90 days, like retroactive coverage.
Got it. I think you just read my mind. One of my questions was, what if people miss their date? Does that mean they don't have coverage for their health care?
Yeah, so people will be disenrolled, and that is how some individuals have found out that they no longer have Medicaid. The way that redeterminations are being sent out is via mail. And so if over the past 3 years during the pandemic people have moved or changed addresses, they might not get the letters. And so they might not know that they need to redetermine, which is part of the reason why we are stressing this so much and trying to get the word out. But because of that, some people, it might be they go to the pharmacy and they're picking up a prescription and they find out that it's no longer covered because they don't have health insurance or they don't have Medicaid.
Okay.
And so that could happen. It usually doesn't happen like right on your due date. It'll happen just based off of like administrative and procedural needs. It'll take some time. So they might not find out right away, but eventually they would be disenrolled from Medicaid and therefore no longer have coverage.
Got it. Okay. So this sounds a little bit urgent, right? So if people have ongoing medical needs, there's a chance that all of a sudden they could not be able to, have insurance cover their medications or a health procedure or something like that. Is that right?
Yes.
Okay. All right. Okay. So what if somebody no longer meets the eligibility criteria for Medicaid? At some point during the COVID pandemic, something in their life happens and their life situation changed and they no longer are eligible for Medicaid.
Yeah, so insurance is a complicated beast, I feel like. But if people have a new job, I would encourage them to check with their employer to see if they have insurance through their employer. Of course, Medicaid, if you no longer qualify for Medicaid. I kind of go down it in rings for me. Like, that's how my mind goes through it to see where you can get it if you to go down the list. So employer, Medicaid, Medicare, and then if you don't qualify for Medicaid, there is the the marketplace, excuse me. So I have the website, I believe, which I want to make sure people know about as well. It's getcovered.illinois.gov or healthcare.gov so that people can check and maneuver the marketplace to see what plan fits best for them. If people have needs there, I encourage them to reach out to 211 or one of the community-based organizations that we've been partnering with is Cognosante. I don't have their information right on me, unfortunately, but these organizations can help. The websites are great. And if you need more assistance, then please reach out. There are people who can help you in terms of managing and navigating the marketplace because it can be overwhelming trying to pick a plan as well.
Yeah. Joy, why is this all so confusing?
That's a really good question. I don't know if I have enough time or brain capacity to answer that question.
Maybe a different topic for a different podcast, huh? Yeah.
Yeah, but we're trying to work through what is the best way to connect people with care and just try to keep it as simple and easy as possible. So when in doubt, call 211. Abe.illinois.gov are your go-to places first and foremost for getting connected to care, or at least knowing the correct place for you to go to get connected with care.
Cool. Okay. Those are great resources. Thanks for sharing. We've covered a lot about what people should do if they have Medicaid, right? Should doctors, clinicians, should those folks be thinking about this and having conversations with patients? What should a medical provider be doing, right now for this?
Yeah. So we want to encourage providers and community-based organizations, anyone who's providing care, to try and integrate redeterminations into procedurally as much as they possibly can. I know that there are a lot of federally qualified health centers and other community-based organizations that provide care that are also in insurance navigators. I believe that's the right term, but they are certified through the Illinois Department of Healthcare and Family Services to assist people with getting connected to health insurance. And when they're a navigator, they can check and see somebody's status through Medi, which is a system that they use to look at benefits, essentially.
Okay.
And so we encourage people, if possible, if they have the capacity in their organization, to get connected with the Illinois Department of Health Care and Family Services, or HFS for short, to get connected with them so that they can build capacity for these pathways to make sure that people can get connected to care and stay on Medicaid or keep their benefits.
Got it. Okay. All right. So that covers healthcare facilities, healthcare organizations. It covers Medicaid patients. What about other community organizations that work a lot with Medicaid patients? Do they have a role to play here?
Of course. Just getting the message out is our 101 kind of basic ask for people. We've been working with the Community Health Response Corps, which is an organization of over 100 community health workers, to table at events so that people are aware of Medicaid redeterminations. Because again, one of the biggest issues is that people just don't know that they need to do it.
Yeah.
And so we're trying to get the message out as much as we possibly can so that people are aware as kind of the first step.
I think you've talked a lot about this, but tell us a little bit about what CDPH, the Chicago Department of Public Health, is doing now to get this message out and to communicate with all of these relevant partners and collaborators in the community.
Yeah, so we've been working with a lot of different entities, both internally and externally. Within CDPH, we've been coordinating the Community Health Bureau, the Office of the Chief Medical Officer, which is where I sit, and our MICA Bureau, Maternal and Infant Child Health, and just whoever we can find that touches or works with community-based organizations or anyone that provides care, the Mental Health Bureau, trying to coordinate as much as possible and disseminate some of the information that we have and that also HFS has put out. So we've been meeting regularly and collaborating with the Illinois Department of Healthcare and Family Services, the Chicago Public Schools, and their Children and Family Benefits Unit, who are doing Medicaid redeterminations constantly and making sure that children and their families stay covered, because you also don't have to be a CPS student or family to get connected with care at one of their offices. We've connected with the Shriver Center. They do amazing trainings about Medicaid redeterminations as well. And 211. Cognosante is an organization that was contracted by CMS, the Center for Medicare and Medicaid Services, to conduct outreach about Medicaid redeterminations and also specifically to help people navigate the marketplace if they no longer qualify. So I know that's a very big web, and that's a lot of different organizations that can be really tough to keep track of it all. But long story short, we're coordinating as much as we possibly can and trying to coordinate resources and services so that we're targeting community areas with high Medicaid enrollment numbers, and that we're partnering organizations that may not have as much capacity or don't have the capacity to directly assist people with enrolling in Medicaid. And trying to connect them with maybe organizations that do. We've met with Cook County as well and are trying to understand what resources they have as well. So there are a lot of moving factors. I would encourage anyone, especially community-based organizations, like if they have needs or could benefit from some of the bridges that we've been building and the connections that we've been building at CDPH, to reach out. I'm assuming we can release my email or put it in the description for this podcast. I don't think people would be able to memorize it. My last name's quite long, so we'll leave that for later.
We'll get the message out somehow.
Yeah.
But basically, if folks in the community want to partner with CDPH to help get the message out, then there's a mechanism for that.
Yes, and we have, especially for like media and messaging and communications, we have resources. We're doing a holiday winter media messaging. I believe we're releasing an image or media communications for tomorrow for Thanksgiving, and then also for winter, don't freeze, renew your Medicaid now, things like that. So we can distribute those if people want to hang them in their facilities or hand them out to patients or clients. And HFS also has resources as well. They have like an Are You Covered toolkit to kind of make sure that people, if they need more detailed instructions and stuff, that those are also available.
Got it. Well, that's great. It sounds like you guys have been keeping busy.
Trying to. Yeah.
Are there certain people in the city or locations in the city that you think are, have the potential to be most impacted by this?
Yes. So we kind of mapped out based off of Medicaid enrollment, which zip codes have the highest Medicaid enrollment. It's tough to know because we don't have consistent up-to-date data throughout the month because it's a monthly thing where people are getting disenrolled. So we don't have those specifics, but just looking at what zip codes and community areas have the highest Medicaid enrollment. And that's how we've been trying to target our outreach. The Community Health Response Corps has been trying to focus in on those community areas when tabling about Medicaid redeterminations. I have the zip codes in my backpack over there, but it's the southwest side. I know North Lawndale, South Lawndale, Brighton Park, and then far southeast, south side of Chicago, and then one zip code in the northwest too. I believe it's Belmont-Cragen.
Okay. All right. Well, this sounds like a complicated process with a lot of moving parts, like you said, not just at CDPH, but really across the city, across the state, and this is going going on across the whole country, right?
Yes,
Okay.
absolutely. And I will say, I will give kudos to HFS and the state for they've enabled or enacted a lot of the safety measures that are available for states. And based off of some of the data that Kaiser Family Foundation has released, just looking at the country as a whole, Illinois has been doing pretty good.
All right.
So our rates are low for disenrollment. So we're excited about that.
That's good news.
Still is thousands of people. So we want to make sure that we continue to do what we're doing.
Yeah, it's still an active process. We still need to watch this closely and make sure that people don't get disenrolled throughout the rest of the year, right?
Yes, yeah.
Okay, all right. Well, thanks so much, Joy. Can you remind us again, so if folks want to get more information about this whole confusing process, can you just remind us about those resources and websites again?
Yeah, so for people who are enrolled in Medicaid and want to check their due date or check their Medicaid status, they can go to Abe.illinois.gov, so Abe.illinois.gov. They can also go to getcovered.illinois if they no longer qualify for Medicaid. I'm thinking what else. HFS has a toolkit, so for providers or community-based organizations, HFS's website is a good place to go, or Illinois Department of Healthcare and Family Services is a good place to go for their toolkit for media and messaging, specific instructions that people can use.
You mentioned 211 too, is that right?
Yes, 211. So Shriver Center, we partnered with Shriver Center, and they did a training for 211 to make sure that the people manning the phones know about Medicaid redeterminations, which was really nice. And they had a story of an individual who called. I think actually it was an older person who called the hotline because one of their constituents lost their Medicaid and they weren't sure how or why. And 211 was able to help them navigate that so that they were able to get connected to care again.
Amazing.
Yeah.
That's like,
so we're doing a thing.
Yeah, that's quintessential Chicago, right? Great. Well, Joy, to end, can you tell us a little bit about where you live in Chicago, what you like to do, maybe some good food you've eaten recently or something like that?
Sure, yeah. I live right off of Diversey by that crazy intersection that's like Diversey, Broadway, and Clark. And one of my favorite places to go is Del Sol. It's Korean tacos.
Oh, yum.
And there's also a new Thai place called Tuk Tuk Thai, I think is what it's called. It's like Thai street food. Also very yummy. 100% recommend the crab rangoons. And yeah, I'm a big reader. I like to jump in the lake when it's not freezing anymore.
You're not one of those people who jump in the frozen lake, the
plunge.
polar plungers?
No, I think I'm okay.
Neither am I. I never.
A bit of a shock to the system, I guess.
People love it, but I've never really been able to convince myself to do that. Yeah.
How about you?
So I live in Albany Park, sort of right on the border of Albany Park and Lincoln Square. We've been exploring. We just moved there recently, so we've been exploring all the taco places and so forth. We actually love cooking from home, and this is sort of dorky, but we love our grocery store up there, Harvest Time Foods. Having a nice little neighborhood grocery store is so awesome, and it's down the street. We can walk there, and they have great produce. So that's one of the things I love about our neighborhood.
Nice.
Yeah. Well, Joy, thanks again for joining us. It was a pleasure having you, and I hope we can talk again soon.
Definitely. Thank you.
And that's our show. Thanks for joining us today. Don't forget to rate and subscribe wherever you find podcasts. I'm Dr. Borah, and we'll see you next time.